welcome to this brief lecture on the second stage of labor. Second stage of labor. So it's going to be short and a bit brief. So what are we going to learn in this lecture? So the first thing is we're going to have an introduction about labor. Then the second thing is actually the definition of second stage of labor. 3, duration. 4, the signs and symptoms. 5, management. That's what we are going to discuss in this simple lecture. So let's start with the introduction. So what is labor? So labor is simply consists of those phases that the woman undergoes later on after during a pregnancy. So when the woman is pregnant, later on towards the end of this pregnancy, which is in the 3rd trimester, she undergoes some various phases, which are actually 4. So you have the first stage of labor, the second stage of labor, the third stage of labor, and the 4th stage of labor. So let me just introduce to you the first stage of labor. So the first stage of labor is from the onset of strong uterine contraction, strong progressive uterine contraction, until the cervix is actually 10 centimeters. So that's first stage of labor. So first stage of labor from progressive uterine contractions until when? Until the cervix is fully dilated, which is at 10 centimeters. What of the second stage of labor? So second stage of labor is from full dilatation of the cervix, which is 10 centimeters, until the baby has been the baby has been delivered. So from 10 centimeters until the baby has been delivered. So that's the second stage of labor. Third stage of labor is from delivery of the baby until the placenta has the placenta and the membranes have been delivered. Fourth stage of labor is 1 hour after delivery of the placenta. So this is the management of the woman in the first hour after delivery of the of the placenta. So let's now go back to our topic for today, which is second stage of labor. So we'll start with the definition of second stage of labor. So second stage of labor, this is the phase. So this is the phase from full dilatation of the cervix until delivery of the baby. So this is the phase from full dilatation of the cervix, which is 10 centimeters, until the baby has been delivered. So what's the duration? So I want to introduce to you these two terms. The first term is prim gravida and the other one is maut gravida or maut parus. So a prim gravida, a woman who we are going to consider to say this is a prime gravida, is a woman who has never birthed a child, is a woman who has never delivered a child. Maut gravida is a woman who has already delivered a child before. So the duration of second stage of labor differs in these two categories of women. So in a primigravida, someone who has never delivered a baby before, it lasts for about 30 to 1 hour, 30 minutes to 1 hour. Then in a multigravida, it just lasts from 15 to 30 minutes. 15 to 30 minutes. So second stage of labor, this is the phase of labor from full dilatation of the cervix, which is 10 centimeters, to delivery of the baby, lasting about 30 to 1 hour in a prime gravida and 15 to 30 minutes in a multigravida. So you should define what second stage labor is. So what is the next thing on the guideline is the signs and symptoms. So how do you know that this woman is in second stage of labor? So the signs and symptoms of second stage of labor, One, we are going to have strong uterine contractions. So remember, during after 8 weeks, after the woman is pregnant, starting from 8 weeks, she starts to experience some contractions. Those are not labor contractions. We call them Braxton Hicks contractions. So we call them what? Braxton Hicks contractions. But in the second stage of labor, these contractions, they become strong and propulsive. They become strong. So when a woman starts to experience strong uterine strong expulsive uterine contractions, this is a sign that she might be in what? In second stage of labor. So remember, I've used the word she might be because this is not a definite sign and symptom of second stage of labor. The other thing that can be there is passage of waters. So passage of waters, this is when the membranes rupture. So when the membranes rupture, she may pass that fluid, which we call liquor. We call it what? Liquor. So that fluid, we call it liquor. Liquor. Yes. So that's the second sign and symptom of second stage of labor. This is also not a definite sign and symptom, as it can occur even before the second stage of labor. The other thing is show. Number 3 is show. So remember, during when the woman is pregnant, there is what? A plug that forms. So there is a plug that forms. This plug is made of mucus that forms on the cervix that protects the woman against ascending infections. So this mucus, due to the dilatation of the cervix, remember in the second stage of labor, the cervix is fully dilated, which is at 10 centimeters. The cervix opens up and this mucus gets to come out. So this mucus in second stage of labor, it may be blood stained. It may contain what? Blood. So this is what we call show. So during pregnancy, we call it leukorrhea. Leukorrhea. Let me just write the spelling for you. So we call it leukorrhea in pregnancy. But in second stage of labor, when this mucus plug contains blood and it is passed, we call it what? Show. And it is a sign and symptom second stage of labor. This can also occur for some other reasons. It's not a definite sign and symptom of second stage of labor. Then the other thing is the number 4 is gaping of the anus. So due to the descending and downward movement and descending of the presenting part of the baby, the anus starts to bulge or starts to gape. So when you see the perineum or the anus bulging, we call that as it's a sign and symptom of second stage of labor. So due to the pressure of this, the fetal presenting part, which may be the head, against the rectum, some women may even pass what? Stool. May pass stool. Then the other thing is the urge to push. So because of these progressive strong uterine contractions, the woman may feel like she needs to push in order to expel whatever is in the uterus. That's number 5. Then the only confirmatory sign and symptom for second stage of labor is number 6, which is full dilatation of the cervix. So when you do your vaginal examination and you find that the cervix is fully dilated, that's a confirmatory test that what? The woman is in second stage of labor. Then number 7 is crowning. So crowning, this is just when you see the presenting part of the baby on the vagina orifice, or you see, okay, the head is now on the opening of the vagina. So we're going, that's also another sign and symptom of what is second stage of labor. So we have done the introduction. We have also defined. We have also done the duration, the signs and symptoms. Now we are going to the management. So let's assume you are the attending midwife at Matero General Hospital. And then a woman